Hi there, I'm Ben. I'm a chiropractor here at Madrid Health, and I'm here with Teresa. Teresa's over 8 months pregnant. And Teresa, in her pregnancy, is suffering a lot from neck pain, some headaches, as well as a lot of low back pain that's actually causing sciatica down the right leg. And you've been feeling that a lot recently. Is that correct?
Yeah, sometimes my leg fails me, and that's why I get this.
Excellent. So we're going to show you right now some basic chiropractic adjustment techniques and soft tissue techniques we use with our tools to help Teresa, and most importantly at this stage, help the birthing process. With any pregnant patient, the real goals are to ease discomfort and to try and make the birth process as comfortable and as easy as possible. So right now on our special pregnancy cushion, our pillow, we're going to go face down. So we have a specialized part here for the pregnancy bump. For a lot of ladies, this is heaven, being face down. When you're pregnant, this far pregnant as well, feels great. You comfortable?
Yeah.
Excellent. So in pregnancy, we put a big emphasis on the thoracic spine because these nerves take control into the diaphragm, into the rib cage, and right now with the pregnancy, that's being stretched because with the extra weight forward, the upper back will naturally do this more. And we start pulling on these big nerves, as you can see here, that come into the rib cage, come into our lungs and diaphragm, and we use that to breathe deep. And that's why a lot of the time in pregnancy, pregnant ladies actually get out of breath very quickly due to the pressure, the discomfort, and the strain on this area. So an adjustment is releasing pressure on the nerves and allowing more movement in the joint so that the body can heal. And the particular part here, like on Teresa, it's T6, T7. See that? It's quite uncomfortable. There's an area that's good to adjust so we can open up these rib cage, and we're getting endorphins released for adjustments. Feel-good hormone, which is something we need plenty of in pregnancy. So an adjustment is actually quite a gentle technique. We're going to breathe in and out. And I isolate the joint, and I put a little bit of pressure and a release. And when you hear a popping sound, it's nothing painful, it feels good, but actually what it is gas bubbles between the joints. So we're taking that pressure off the joint. We're going to breathe in again. We're going to release what's called T3. So it comes more into the shoulder muscles as well, like that. Now in the low back here, for Teresa's benefit, we got a lot of pressure on what's called L4-5, and these are big joints and nerve roots in the low back that control down the leg here, into the buttocks and down the leg. And underneath that we have the pelvis area. Now this area, like where I'm pressing here, this area is expanding in pregnancy, especially at this stage. These pelvic ligaments are getting looser because they need to open for the birthing process. Now this is where a lot of pregnant ladies, they get a lot of discomfort and pain because this area gets so tight, it starts pulling down the nerve root, and that's when we get pinching of the area, affecting the nerve down the leg here. What we like to do, and you demonstrate it here in pregnancy, we use specialized, what's called vibropercussives, specialized high frequency percussion vibration tools, and we can allow this area to move better then. So we get right on the low back here, so on L4-5, and just lightly pressing into that region. It's really important as well that it comes slightly off when we get on what's called the piriformis insertion. It's an area where the nerve runs down through the muscle that, especially in pregnancy, can get quite stuck. Now as we contract that, I like to contract it more, so I bend the knee, I pull that across, I can push that forward so we contract deeper into the area. This machine is very powerful and can reduce trigger points in 30 seconds to a minute. However, we have this on several minutes to diffuse all that tension. It allows blood flow to travel up and down the spine as well. Into the mid back here, and relax into the shoulder muscles. this, I'm also checking the spine. I'm feeling any leftover tension. I know I need to come back here on L4-5.
Oh yeah.
Press. In pregnancy, we come onto the base of the heel. The reason being is in pregnancy is normal to get a bit of swelling around the ankle, the blood pooling effect, and this causes tension around the ankle joint here. So in a minute I'll be adjusting the ankles to stimulate movement and blood flow, but at the same time, percussion, I can really relax down the muscle tissue around here, the tendons. To demonstrate, it's called a machine-assisted adjustment here. Again, this is using percussion. This allows me to really isolate in the joint like L5 here. You get either side, we aim it slightly down. And we can push into that. Sometimes I use what's called an activator to place a little bit more specific focus. And so it's just a very painless, just very specific push onto the side of the joint here on the right side where you've got most pressure. And I want to stimulate into the pelvic ligaments, so I just let me pull and that's good. And the same on this side, this is very good for pregnancy and pull. And that's good. So now we're going to turn over and we're going to demonstrate some cervical releases. Okay. Now when we do releases around the neck tissue here, really this is designed to stimulate endorphins down the spine. And when we adjust C1-2 right at the top of the joints here, this helps release those feel-good hormones down the spine, which in pregnancy helps relax the body. And that's why we want to do it, as well as to help sleep pattern. These hormones relate to your vagus nerve, which helps you sleep deeper at night. So we're going to lightly activate. There's a lot of stress here in the upper levels. So it's going to cause a nice relaxation. Now these kind of adjustments, again, any pop, it's just gas bubbles, so it's actually a very gentle technique. So I isolate C1-2, I isolate my contact, I'm going to keep the mouth open, there's a little push, like that. And the other side, and isolate C1-2, push. Just do a light stretch, just like that, and hold. Now we check into the ankles. Again, this helps low back focus, especially when we're moving a lot during pregnancy. It's important to keep walking. On both ankles, Teresa, there's a lot of pressure on what's called the talus joint here. So I do a light adjustment to stimulate movement. So it's a light more like that. I'll do it one more time. Good, release, good pop. And we'll isolate, and then it's a little pull. In pregnancy, we like to check around the pubic here, what's called the psoas insertion. Slightly on this side here, and I push it in, and I'm pushing out with my fingers. I hold that insertion for several seconds. Like that. So that releases in my fingers, and then I give the hip a light stretch. A few seconds. That's good. And come around on the other side. Do the same again. We're going to relax the leg and we get a light. also I'm very happy with that adjustment. And then the idea again is that we want to improve the body for the delivery process, as well as remove any discomfort and pain felt during this stage. So we're going to lightly sit up to me. I'm going to help. And the legs around. How'd you feel? Better?
Yeah.
Good?
Yeah.